Welcome back to our Technology Track series. We're going to talk about return on investment, and specifically we're going to talk about soft tissue lasers in this segment. Now, just as we evaluate all pieces of technology or equipment, we're going to take a look at risks and we're going to take a look at benefits. We're going to do it a little bit differently in this segment than we will with other technology segments because lasers are pretty straightforward, they're pretty cut and dry. So, if we look at the first category of finances on both the risk and benefit side, there are a couple things to consider. Lasers are priced all over the board. You can spend $2,500 on a laser, you can spend $12,000 on a laser. Now, when you purchase a more expensive laser, you get some bells and whistles. It's a little sleeker of a unit, it's smaller, maybe it's a little more portable. But in most worlds today, you can get a pretty compact unit for a very reasonable price. So the cost of getting into lasers, a lot lower than getting into a lot of other pieces of technology. The bigger question from a cost standpoint, risk to benefit, is how are you doing it right now as a dental student? Probably a lot like most dental practices are doing it. You're packing cord. So how expensive is cord? It's pretty cheap. You can pack cord on the average patient for somewhere between 50 cents and $1, which means if you purchase a $2,500 laser, you're going to do an awful lot of units of crown and bridge, call it 2,500, before you ever actually reach the cost of your investment. Now, from the benefit side of money, what do you gain if you purchase a laser as opposed to packing cord? You actually gain a lot. We have timed, not myself, but many researchers have timed the average clinician on how long it takes to pack a cord well versus how long it takes to utilize a laser well. It's about 4 minutes to pack cord. It's under a minute to utilize a laser. So you can imagine if you're in the typical private practice that is working on 4 to 5 crown and bridge units a day, or teeth that just require isolation. Maybe it's a class 5 restoration that you're doing directly but you can't access it. If it's going to take you 4 minutes to pack that cord and a minute to utilize a laser, and you do that 5 times a day, 5 days a week, 52 weeks a year, it's not going to take you long to get to that $2,500 investment that you made. So, even though money seems like an obstacle because it's so inexpensive to purchase cord, from a time standpoint, a management standpoint, lasers win that battle over the course of maybe a year, 2 years at the very, very most. What about learning curve on the risk side? Lasers are really easy to get to use. They're pretty self-explanatory. They function mainly like an iPhone in today's world. You can pull up a home screen, you can press a tab to describe exactly the procedure you're going to do, and even the most inexpensive lasers today gear themselves so they get to the right wattage and the right pulse to make that procedure happen. So there's no thought process to speak of whatsoever. So learning curve, not really a risk at all. What about on the flip side? What if we're looking at better treatment as a benefit? Lasers are wonderful adjuncts to patient care. Packing cord can be harmful to tissue. It's hard to figure out who that patient's going to be, that pressure you're putting in their mouth means you're going to move their tissue to a bad spot once they recover from the procedure. A laser is really predictable. Whatever you see once you've lasered the tissue, in health is where that tissue is going to remain. So you and I can know on a very consistent basis that where we place a margin, what we're trying to uncover, will be there in a month, in 6 months, or in 5 years, so long as that tissue is healthy. Again, looking at risk, integration, not so hard to integrate a laser. You and I like this piece of technology because it's really easy to use and none of us like to pack cord. Another opportunity for integration, so in this case we can throw it over to the benefit side, is lasers are tremendous in hygiene. And in most states, a hygienist can be licensed or certified to use a soft tissue laser, both for basic periodontal therapy. It can be used for treatment of aphthous ulcers, can be used for canker sores. There's a lot of different things you can use a soft tissue laser for, and the more you use one, the more you're going to see uses for it. So they're awesome. What about marketing? Again, like every piece of technology that you bring into your practice, huge opportunity to separate yourself from the practice down the street. If you have a patient who's ever had the need to have isolation improved with cord, I promise you they're going to remember that experience. Whether they were numb or not, they remember you using all your force to get that cord packed in that sulcus. On the flip side, when you bring out the protective eyewear and put it in their mouth, and you ask them if they remember that experience with cord, and now you tell them that instead of 4 minutes of you leaning on them, it's going to take 30 seconds to a minute to isolate their tissue, they're pumped. And when they go home, they're going to talk about how much easier their patient experience was. So soft tissue lasers, in the end of it all, from a return on investment standpoint, terrific investment to make in your practice, relatively inexpensive both upfront and over the long haul, and will help you provide better patient care and help you build your business.